walk me through your process. Like if you have a person who's going to see you for both, they're getting that extended time. What's your plan?
So it depends all on the condition on the plan of care. Meaning, because everyone is different, right? So let's say like you come for your knee. Your knee may not be the same as the person next to you and the other person next to you. So I have to treat your knee differently, right? And depends on the goal. Especially, let's say for example, is if you just had a surgery on that knee. There's a certain protocols and things that we have to achieve. And then let's say like I see that you're struggling during the previous visit, you were struggling getting that muscle, getting you to feel that muscle in front of you, like the quads muscle, right? Like commonly people want to activate, right? You're struggling with it. So and I'm like, okay, so then I can either make you go through this set of exercises, try to make you feel it, or I can actually use the acupuncture treatment to get that muscle to be activated, right? Because acupuncture is not just cannot be used just for relaxation or trying to open up, or like we said before, to regulation of hormones, but it can also be used to wake up a muscle and release a muscle. So if I want to activate one of the muscles in front of the leg, some of the squat muscles for that kind of knee issue, right? I can use an acupuncture treatment to wake up the whole front of the leg, get it nice and ready, right, nice and warm. And then after that, I can follow up with a PT treatment. So now the patient will be able to feel that muscle more during the exercises, which that will lead to a better outcome. It could be, like in other cases, could be maybe the patient is able to feel it, but then, we can go through around the PT session where we do the exercises and we do the progression, but then afterwards, like they usually tend to feel super tired after one, and then maybe they need some recovery. So maybe PT can be done first, get the muscle to get going, to be activated, to get stronger, and then acupuncture can be done afterwards to try to release some of the muscle soreness that the patient will experience. So everyone can be different. That's why the proper assessment needs to be done. Yeah, no, there's a night and day difference. I've been to the other places where I had to treat 4 and 5 an hour, where I was only able to see that patient for like 10 minutes and then send them out to the gym area and they have them, do the exercises either by themselves, or if they were lucky with another kid that was only telling them list by list what the exercises needed to be done. But sadly, in those places, like you don't get to cater to that patient, right? You don't get to, every knee tends to be treated the same. Knee pain, let's do the same thing because it's not really time. In 10 minutes, by the time the patient sits and you say hello to the patient, that's already 2 minutes. Because I want to hear how your day is going. So like that's already 2 minutes. And then so I already have 8 minutes to work with you. So you see like it's really not enough time. So you don't get to see that patient progressing and getting back to the life they want because there's just not enough time for it. Luckily in here we're able to do at least the 1 hour. Sometimes patient likes to hang out here the whole day because they're having such a good time. But we're able to see the progress faster. We're able to get them back to the field where they need to be. They're back to their game where they need to be. Or if their parents, or maybe they want to hang out with the kids a little bit more, they get to spend more time with them because they're recovering faster. Especially nowadays, like everyone is busy. I'm busy. You're busy. Everyone is busy. We don't have time to be taking at least an hour and a half to 2 hours to go to a place to get better. People want to see results, get things done. So in here, luckily we're able to help them achieve that goal faster and better because we get to spend time with them. Yeah, we all know time is valuable. So luckily, we're able to give our time to people, and then so they can enjoy the time as well.
Eastern Western medicine, you've talked about that.
Mm-hmm.
I've kind of heard about that. You blend them together, right? How do you see the difference in results when you're blending those two, to which some people alienate them, right? They shouldn't, they don't mix, all that kind of stuff. But here, as someone who's been a patient of yours, it's actually worked. How does your philosophy work? Like that's, because it's awesome. Literally great results. I used to think acupuncture was,
Most of people do, because I think it's just not knowing. Yeah. So if you don't know something, you get to be more defensive or more like, how's it gonna work if I don't know anything about it? That's where the education comes into place. But I think I've been lucky enough, I want to say that I've been exposed to education especially teaching anatomy to graduate students, graduate PT students and PA students. So I get to use that information that I have gained through teaching, through kind of put both points together. Because at the end, a lot of the points or the theories, they're saying the same thing. It's just described in a more poetic way or more structural way. Yeah. Instead of calling muscle, this muscle does this action to extend the knee, right? That would be more like in a Western one. Then in acupuncture would be this muscle opens up the knee. They're saying the same thing. They were really, they just, they were more poetic, or they were describing the motion instead of just describing the, just giving it a name, pure name. So just, being able to kind of blend those in helps a lot. And then nowadays, I guess this information, kind of blending those in is kind of like more, it's being brought up a little bit more with people like just Googling, right, stuff. And they're like, oh, what is this going to do? And now there's another thing that is coming up a lot with dry needling and acupuncture. Yeah. Big subject right now. And then I like to educate people on the differences, and then the benefits of it, right?
Yeah. So walk me through that.
So one of the things is acupuncture, of course, is it looks at the body as a whole, meaning head to toe, what's going on with that specific part of, where it hurts, but what's going on with the circulation around it, what's going on with the lymph nodes around it, how come it's not healing? There could be a blockage of the lymph nodes getting all the bad stuff to come out of the joint, right? It could be poor circulation, so it looks into that, or maybe they're like, especially the athletes, they're like, oh, I'm going through this strict diet and all of that, and I'm still sore, I'm still not healing, but maybe one of the organs is not working like it should and not absorbing all those, that chicken and brown rice that you're eating and broccoli, right? So then it looks into the organs too, if they're performing like they should be. Right, so that's why most of the treatments are being done not just like on your shoulder. Let's say the shoulder hurts. There's some points that can be done around the feet, around the knee, and just to stimulate all the blood flow and kind of lymph nodes around that area, right? So typical treatments involve needles and across the body, and kind of and not just in a point where it hurts. Right, but then one of the things that has come up lately is the use of dry needling, which it is an acupuncture technique. Dry needling is basically used by non-acupuncturists, usually chiropractors and physical therapists, and then they have to go through this training to kind of being able to safely use the needle, and also how not to hurt someone by using the needle, right? But the whole point when they do it is let's say there's tight spot right in this area. By palpation, they can typically, they would do it through a massage, a soft tissue release, any kind of machine. But now, they can see the benefits of the acupuncturists have used. Is they can actually use a super thin needle. They're super thin. They're almost like almost a hair acupuncture needle. They can directly go to that muscle, that tight knot that you have in the muscle, go in there, release it, and then they can follow it up with the exercise. So it is an acupuncture technique to kind of release a muscle. So there's a difference. Yes, it's more of a local treatment. So it does work really well, but everything has to be used appropriately, right? So then people are like, oh, then how do I, when do I keep, or how often should I be using it? It's you have to see releasing it, you do some exercises. If it gets better, good. But if it's not getting better, maybe there might be a time to be assessed by an acupuncturist to look at the whole body. How come after 5 treatments of this is not going?
And that's strengthening.
Exactly, and that's strengthening also looking at acupuncture, looking at the whole body, the circulation of the joint, at the blood flow of the joint, at the lymph nodes of the joint, at the nerves around the joint. So there's a time and place for everything, and I think both of them kind of live in harmony as long as they're being used appropriately.